Hi, everyone. Welcome to my presentation on South Shore Works and my project, which is creating a podcast with them. In this presentation, I will review the organization I work with, the project I have started and am evaluating, looking at who is involved and at stake with this project, as well as how the project can be sustained going forward. My CBSL site is South Shore Works, which is an organization committed to revitalizing the South Shore community. They offer a variety of programs to improve healthcare outcomes, support local businesses, and provide educational needs, as well as their attempt to decrease violence. A board of directors approves decisions for the organization, and then a team of paid staff carries out the work. And all of their staff, projects, and endeavors are funded through grants and donations. So, just who exactly is living in the South Shore neighborhood? According to Chicago Metropolitan Agency for Planning, 93% of the population is Black, 42% are between the age of 20 to 49, and 90% have completed high school and beyond. The age statistic here is important to know because it factors into my project, which we'll discuss later. My project with South Shore Works is creating a podcast. I started working on this in the fall of 2021, and so far have completed 3 episodes with plans to release episodes 4 and 5 in June of 2022. The podcast has conversations about health promotion, community engagement, and supporting local businesses. The healthcare promotion aspect is the most important topic because the South Shore neighborhood is considered a healthcare desert. In the second episode I released, I spoke with a nurse at South Shore Hospital who stated that many people discharge from the hospital and right back up in there because they don't have a doctor's office accessible to them that provides the follow-up care they need. So if we can share how people can access the support that they need, maybe we'll be able to reduce the return rate at the hospital. In our first episode, I'd hoped to have 15 listens, but I actually had 23, so that was exciting. And I'm hoping to reach 50 listens by the 5th podcast, and that will hopefully be coming out in the next couple weeks. If I can do that, I will have met all 3 of my goals created at the start of the program. I originally hoped to be able to see where the listeners are from to know if the episodes are actually reaching the South Shore community, but unfortunately, we don't have that capability with our current podcast software. So why do a podcast? And to that I say, why not do a podcast? We're always looking for new ways to disseminate information in a way that's conducive to people's needs. Podcasts are extremely easy, they're inexpensive, and they're a low risk way of sharing information. So going back to the statistic I discussed earlier, we need to understand that the vast majority of podcast listeners are between the ages of 20 to 50, which is the age bracket that makes up 42% of the South Shore community. So right there, we have the right age bracket within the community to utilize this program. When evaluating the project, we're going to look at the number of listens per episode, whether the content was relevant based on feedback from listeners, and we're also going to see if there's been any engagement about the episode on our Facebook page. The long-term goals of the podcast align with South Shore Works goals of improving the health of the community, improving the local economy, and reducing crime. I plan to survey listeners 1 to 2 times per year to ensure the content, length, and format are what they want to hear. This is another place where I could ask the listener where they live and how they're connected to the South Shore to see if I'm reaching the target audience. But hopefully this project will disseminate information that will lead to increased business support in the South Shore neighborhood and improved healthcare outcomes overall. So when looking at the risk of doing this project and who is at stake, there's very little risk involved overall. There's little to no risk for myself and the interviewees, aside from maybe embarrassing myself sometimes in interviews. And the organization itself has very little risk because I'm volunteering my time, and the only cost is $9 per month for our current podcast software. The only people truly at risk are the community members themselves who would lose out on accessing this information if the podcast were not to continue. So sustainability, I believe this program can be pretty easily sustained through more CBSL students. And if it gains more support from the community, we could consider expanding the podcast team to more than just me. We could create eco-friendly marketing materials to promote it. We could set a more regular schedule for episodes to drop, and we could continue surveying listeners to ensure we are providing the content they want and need, and that it's and all of those things are going to be vital to the success of the podcast. So thank you so much for checking out my podcast project here at South Shore Works. And if you have any other questions, feel free to reach out to me. Thank you.